Hi everyone, welcome to my channel, Root Yoga Therapy. I'm your certified yoga therapist, Jasmine Leventhal, and we're here at 36 weeks pregnant, and this is going to be the last video of our prenatal yoga therapy series. I hope that you've been following along my journey through pregnancy, and some of the tools that we've offered have helped you during your pregnancy, and hopefully also given you some things to bring into your labor and delivery. I want to conclude our series by offering a practice that's going to introduce 3 breath techniques to help stimulate and activate your relaxation response in your body. So these are relaxing breathing techniques that definitely would encourage you to use during your labor and delivery, but also if you're waking up feeling anxious or stressed or overwhelmed, these are absolutely breathing techniques that you can use in those situations as well. You don't have to be pregnant to incorporate these, but they are definitely going to be beneficial for you and completely safe for your pregnancy. So go ahead and hop into something comfy and join me on your mat. Okay, welcome back. So we're gonna kind of jump right in. I'm gonna explain a little bit about why stimulating our relaxation response is important, what actually happens to the body when we do that, and how this is going to be probably the biggest tool you're gonna need for your labor and delivery. Now, I'm sitting in a supported squatted position. I have 2 blocks underneath my sit bones, and I've pressed myself all the way back towards the wall for support around my pelvis and lower spine. And this is a great laboring position as well. This is going to encourage the baby to descend downward into the pelvis, get that pelvic engagement, and work his or her way down into your birth canal as you prepare for birth. So I think this is a great position to do our relaxation techniques in. It's also a really nice place to get a little stretch and opening around your hips. But if this is not comfortable for you for any reason, please feel free to find a position where you can be comfortable and still as we move through these techniques. The first technique I'm going to talk about is a really simple breath called Samavriti breathing, and it's basically just an even breath. So we'll work on that. We'll move into something called an extended exhalation breathing, meaning that we'll start to work, just as it sounds, a longer exhale. And we'll also work a 3-part breath. So we'll teach how to break the breath down and why that breath or when that breath will be useful. Now, stimulating the relaxation response is going to be key to helping reduce inflammation, pain, and really allow your body to do the work that it knows intuitively how to do during labor. And it's really important when we're experiencing pain or any type of discomfort. It's kind of a natural reaction to tense up. So it's going to be super important to remind ourselves to use some of these techniques so we can soften, we can surrender, and really allow the body to take over. And if we are able to manage the tension and the stress during labor, the hope is that we'll be able to also better manage the discomfort or pain of the contractions. And if you're somebody who's going for a non-medicated or unmedicated birth, these tools are going to be key as we move through that process. So even if you're planning to get an epidural or not, finding that space to relax, to connect with your body and your baby is going to be super important and a big part of the journey and the experience. So the first breath, as we've discussed, is going to be the even breath. Now, this is exactly as it sounds. We're going to start to find what your regular breath pattern is, and then we're going to start to even that out. So typically when we're in a stressed breath pattern, we have short, shallow breaths. and we are often holding our breath or we're not exhaling enough. Now that's a big key in yogic breathing, is that we focus on the exhalation. The exhalation is going to invite in a deeper inhalation. Most of us think about breathing as just simply taking air into the body. But the reality is that it's more important to expel air out of the body, or CO2, because our bodies naturally want to breathe. And we need to create that space for that breath and also prana, that life force, to come in. Bringing in those nice full breaths is also going to help oxygenate the body, which is going to be super important for baby, for your muscles, for circulation and blood flow, and to also help balance out the hormones in the body. So we'll begin. Find your comfortable position. You're welcome to work with your eyes closed. You're welcome to have hands on your belly, or simply having your hands resting alongside your legs. I always find it nice to have hands on the belly, just to make that connection with baby, but also to feel the movement of the belly as you breathe. Another sign to look for if you're in a stressed breathing pattern is this upper clavicular or chest breathing. So again, if you find that the breaths are short and shallow, or that the breath is kind of locked up in the chest and shoulders, it's going to indicate that we're in a stressed state. And we're going to start to want to implement some of these few breath practices to help us move from that place of fight flight to a place of calm and ease. So let's begin. First, I just want you to completely notice your natural breath. So you can close your eyes, you don't have to change anything. Just simply notice the natural rhythm of your breath. And you might find that you're breathing in and out through your nose, or your mouth, or maybe both your nose and mouth. You also might find that the shoulders are lifting, or the chest is rising, or the belly is rising. So kind of observing the parts of your body that are moving in relationship with your breath. And this is a good place to just establish the baseline of your breathing. We're going to go ahead and incorporate the even breath. So on my count, I'm going to count to 3 on both the inhale and down from 3 on the exhale. And you're going to begin to match your breath to the counting or rhythm of my count. So finding that long exhale, just expelling all the breath out of the body, feeling your belly drive in towards your spine. So the belly should kind of shrink, like you're gently hugging and holding baby in and up into the body. And on 3 for the inhale, for 1, 2, 3, feeling your belly expanding into your hands. Exhaling for 3, 2, 1. Inhaling, 1, 2, 3. Exhaling for 3, 2, 1. Inhaling, 1, 2, 3. Exhaling for 3, 2, 1. Good. Lots of space. Inhale. 1, 2, 3. Exhale. 3, 2, 1. Gently hugging baby. Good. Taking 3 more together. Inhaling for 1, 2, 3. Exhale for 3, 2, 1. Inhaling, 1, 2, 3. Exhaling for 3, 2, 1. Nice. Last round. Inhale, 1, 2, 3. Exhale for 3, 2, 1. Very good. Let's take a cleansing breath. So inhaling through our nose, open the mouth, open the throat. Good. Inhaling through the nose. And good. So that is the Samavriti, or even breath practice. It's very beneficial, again, when you notice that short, shallow breathing pattern, to start evening out the breath and immediately send that calming sensation back into the body, removing ourselves from the sense of panic or stress or fight or flight. The second breath, we're going to expand on that even breath and do an extended exhalation breathing. So we did a 3 count in and 3 count out previously. Now we're going to work that exhalation up to a 6 count. Now, this might not feel right for you, especially if you're newer to a breath practice. So don't feel the need to go to 6 if you feel like it's straining on the body. You simply would just go to like a 4 or a 5. So we'll still have that 3 count inhale, but this time we'll exhale for either a 4, and then we'll practice a 5, and then we'll practice a 6. Again, if that 6 count feels strenuous on the body, just simply stop at a 4 or wherever you feel most comfortable. Over time, as you continue to practice over the last few weeks of your pregnancy, that exhalation likely will grow, and you might be at that 6 count by the time you're ready for labor and delivery. So finding that comfortable automatic breathing pattern in and out through your nose if possible. And cleansing out the breath by taking that nice, complete exhalation. And we'll begin inhaling for 1, 2, 3. Exhale for 4, 3, 2, 1. So a little longer. Inhaling 1, 2, 3. Exhaling for 4, 3, 2, 1. Inhaling 1, 2, 3. Exhaling for 4, 3, 2, 1. One more. Inhale 1, 2, 3. Exhale for 4, 3, 2, 1. We'll expand that to 5, then 6. Inhaling for 1, 2, 3. Gently hugging baby for 5, 4, 3, 2, 1. Inhale 1, 2, 3. Exhale for 5, 4, 3, 2, 1. One more. Inhale 1, 2, 3. Exhale for 5, 4, 3, 2, 1. Now 6. Inhale for 1, 2, 3. Exhale for 6, 5, 4, 3, 2, 1. Long exhale there. Inhale, full breath. 1, 2, 3. Exhale for 6, 5, 4, 3, 2, 1. One more. Inhale. 1, 2, 3. Exhale for 6, 5, 4, 3, 2, and 1. Good cleansing breath. Inhaling through the nose. Open mouth, open throat. Again, inhaling through the nose. Open mouth, open throat. Nice job. So you might have felt that when we were approaching that 6 count, that exhale was a little difficult. And if that was the case, again, please feel free to stop at 4 or 5. And as you continue to practice over the last few weeks of your pregnancy, you might find that that breath naturally expands on its own. Those cleansing breaths in between these practices are also really important. Those are really good things to include during your labor and delivery process. Again, when you're finding that you're in that short, shallow breath pattern or stress breath pattern. Just taking a nice full breath in through the nose, open mouth, open throat. That will help release the diaphragm and pelvic floor, and big sigh. With that sound, we're looking for a big, round, deep sound. So if you notice that the throat is tight, constricted, or closed, that's a good indicator that there's tension in the body. So if the sound on that cleansing breath exhale is really tight, and it's not open or rounded, there's a difference there, then it's a good indicator that we're not completely surrendering or letting go in our bodies. So another little tool to include and help you find more space and more ease throughout your pregnancy process. The last breath that I'm going to teach is a 3-part breath practice. So this is a really great way to slow breathing down because it forces us to break down that inhale and find a nice, long, steady exhale. Typically, if we're in a panic or we're feeling anxious, we're going to have quick, short inhalations. Sounds kind of like a panic attack. And oftentimes, many of my clients notice that they actually hold their breath. Well, we typically hold on that inhalation. So breaking that inhale down into a couple different parts and then finding that nice long exhale is going to encourage us to slow down and realign and recenter with our bodies and our babies. Don't forget, as we go through the labor process, oftentimes it could be an out-of-body or another conscious experience. So we might not be feeling super grounded. The breath is a great way to recenter and reground back into the body and to regain control over the way we are reacting or responding to our labor. And again, this is something that our bodies intuitively know how to do. They were meant for this moment, and it's important to recognize that there might be fear and anxiety and stress showing up, but also to hold what's really important, that we're birthing life, and soon we'll be holding our little baby in our arms. So the last breath, 3-part breathing. This one I will ask you to use your hands because I feel like it will be a little easier to connect. So the first breath is going to happen into the belly. The belly is going to get really big. The second breath, we're going to pull that breath up into the chest. And then a long exhale. Now that exhale, I find it really helpful to come out the mouth. But again, nostril breathing is encouraged. But when we're learning, sometimes having that open mouth exhale is a little easier to connect with. So inhaling through the nose into the belly, 1. Pulling that breath into the chest, 2. And open mouth exhale, 3. So those are the 3 parts of the breath. And we'll practice together. Hands on belly, taking that nice inhale. Make that belly press into the hands. Hold, pull the belly or the breath up into the chest. Hold, and then long exhale out the mouth. So breaking it down. Inhale. Inhale. Long exhale. Good. Inhale. Inhale, chest. Long exhale. Inhale, belly. Inhale, chest. Long exhale. Good. Inhale, belly. Inhale, chest. Long exhale. Nice work. So those 3 breaths, I encourage you to continue to practice, and hopefully these can be driving tools and resources you can rely upon for labor and delivery, or anytime you're feeling a little stressed, overwhelmed, anxious, and fearful. I know that these are things I'm going to be using as I move through my experience as well. I wish you the best over the next few weeks until your baby arrives, anywhere between 37 and 42 weeks. And I also truly enjoyed sharing my journey with you and sharing the tools and the practices that I've been incorporating to help me stay grounded, centered, and strong throughout my pregnancy. If you haven't already, please subscribe to our channel to continue to follow the journey postpartum, as well as pretty much basic practices for healthy bodies, and any other kind of chronic symptoms that I'll be sharing around sleep, around pain, around anxiety, around depression, and really anything that you, the audience, is looking to gain tools and support around. Again, thank you so much for tuning in along these last few months. And I cannot wait to see you on the other side. Namaste.